Hi, and welcome to another version of Pearls of Wisdom, sponsored by Delta Dental of Massachusetts. I cannot believe that we're almost to the end of another year, and this is our year-end episode. We've given you many topics that are somewhat serious in nature, whether it be COVID infection control, artificial intelligence, diversity, equity, and inclusion, or the one we did just recently on teen vaping, which I think is going to have an impact on so many people. So today, we're actually going to slow it down a little bit and have a little fun with today. We're talking about oral health and its impact during the holiday season. And today I have a good friend, a coworker, and a frequent guest on our program, Dr. Linda Vidone, who's our VP and Dental Director for Delta Dental of Massachusetts. Linda, welcome.
Thanks for having me back, Dennis.
Yeah, so there's no pressure here today. We're just going to have fun, and we're going to talk about the holidays and how it impacts your oral health, which could be significant. To start out, holidays can be very stressful for a lot of people. There's so much that needs to get done, and many times people will say, the last thing on my list is going to the dentist. So let's just start out about why it's so important to get a checkup, and then we'll just take it from there.
Sure. So, I think we're all used to procrastination, especially this year, last year, going to the dentist. We had other things on our mind, but it's still so important. That hygienist and dentist could actually help you with your New Year's resolutions.
Yeah, there's no question about that. So in your practice, are you seeing people that have stayed away from the dentist and you've seen the impact on their oral health, people coming in with more cavities, not because they're necessarily it could be they're not eating properly, but it's just they're afraid to go to the dentist. We saw a lot of that in 2020, and we're still seeing it in 2021.
We're still seeing it, but patients are coming back. So first of all, going to the dentist is safe. There have been no outbreaks of COVID recorded at the dental offices whatsoever. But in answer to your question about decay, what we have been seeing, Dennis, is teeth fracturing. Old fillings breaking down. People are grinding their teeth, clenching their teeth. Their home habits are different now. There's anxiety. They're not sleeping. They're still working at home. I read an article just yesterday that in fact root canals have increased during COVID, which means that there could have been decay there that has now turned into root canal because they didn't come in when that could have been done just a filling, as opposed to now needing a root canal.
And when they're grinding their teeth, the clinical term is bruxism, correct?
Correct.
Yeah, I'm just showing off my talent of medical knowledge. That's all.
And you are talented.
Well, yeah, very talented. So Linda, people are stressed out and they're trying to fit that dental visit in. They know it's important. Most people know it's important. How do you begin that conversation about making sure people understand the importance of good nutrition, good oral health? Because what you eat really does impact.
Absolutely. The first thing we have to do is keep these goals realistic, approachable, and why not fun, Dennis? Okay? So especially during this time of year, everybody's going to parties and maybe overindulging a little bit. So maybe start with a little fun fact. Do you prefer red or white wine? And what do you think is best for your oral health? So let's start red wine. No doubt it can stain your teeth, but it's actually heart healthy. There are chemicals in there that help decrease that streptococcus mutans, which causes tooth decay, as well as decrease inflammation, which causes gum disease and periodontal disease. So then we have white wine. People think, okay, well, that sounds like it's better, but actually not really, because it has sugar in it and it's very acidic. However, though, don't put the white wine in the naughty list yet, Dennis, because there are ways we can combat the acid attacks by drinking white wine. For example, eat cheese with the white wine or drink a lot of water to help dilute the sugar in that white wine.
So people, you heard it here today. Red wine is a good thing. We should put on the bottom of our screen, please drink responsibly. So Linda, you're at a holiday party. Let's help our audience make some better food decisions. What are some of the things that they should be eating?
You want to reach for fresh fruit, fresh vegetables, carrots, celery, pears, apples, high water content, as well as it flushes away some of the particles and the bacteria that's in your mouth. You might want to try nuts. Nuts are great. They have potassium, zinc, phosphate in them, all things that help combat the demineralization of the tooth.
And they do get stuck in my teeth as well, but that's okay. Good advice.
You don't want to, though, chew on ice, that cracks your teeth, as well as like take a candy cane and just bite into that. That's one thing you don't want to do. Avoid the sticky candy. Chocolate's great if you're going to reach for something. It dissolves.
So now you've given us red wine and chocolate. It's a bonanza day here on Pearls of Wisdom. That's great.
How
Thank
about
you.
chocolate-covered strawberries,
Even
Dennis?
better. The trifecta. That's great. All kidding aside, though, I think that's a great tip. Talk to us about how a provider can start having that conversation with patients. What are some of the techniques you may use?
Right, and I think it's a great way to start the hygienist even talking to them about what's your New Year's resolution. It could include
Drinking more red wine.
increase home health, oral health habits, brushing twice a day, flossing. You know, when you're looking for gifts, stocking stuffers, for example, you might want to upgrade that toothbrush to an electric toothbrush, or, you know, for kids, their favorite character is a battery operated toothbrush. You know, put in their stockings maybe some mints or gum with xylitol that helps decrease tooth decay.
We have xylitol here at Delta Dental in Massachusetts, and we've had it here for over a decade. That's something that most people don't know about. We weren't scheduled to talk about that, but let's talk a little bit about xylitol, because it is such a better alternative to not only sugar-free gum, but obviously the sugary gum.
Well, even chewing sugarless gum in general, it stimulates saliva formation. The more saliva, which is actually buffering for that bacteria that produces acids that eventually cause tooth decay. Xylitol is a product that actually counteracts the acids and the Streptococcus mutans that causes the tooth decay.
All great information. Let's talk a little bit about now the people who don't come this year. The good news for most people is their calendar year max kicks in January. Let's talk a little, get off script a little bit and talk about that, because some people that say, you know what, I have too much going on. It's the Christmas season, it's the holiday season. I have gifts, I've got to prepare food, I'm traveling, I can't get to it till January. Let's talk a little bit about that impact too.
Well, you know, dentists, they do send reminder postcards, and even if you can't make it before 2021 is over, start the new year right. You know, we don't want to penalize the people that really can't make it. We want to encourage them to come no matter when they come and can schedule that appointment. You know, another stocking stuffer is, like you mentioned, there are people out there that don't have dental insurance. Why not give the gift of dental insurance? You know, there's individual plans that are being sold now, senior plans that are being sold.
Great. Well, I think all of those are great suggestions. I want to thank you again. You are by far, I think, the most frequent guest on our show, and you're also one of the best. So we thank you for that. Thank you.
Thank
so
you for
much.
having me, Dennis, and happy holidays.
Thank you very much. So we hope you enjoyed our kind of lighter take on oral health today. I want to say to all of our providers, and really all of our dental staff, not just the providers, but the dental assistants and the hygienists, on behalf of everybody at Delta Dental of Massachusetts, I want to wish all of you a safe, healthy, and happy holiday season.